Hi, this is Dr. Spencer Zimmerman, Functional Medicine Center of Boise. Today I want to talk about the vestibular system. The vestibular system is critical for balance, but it's also one of the systems most overlooked during concussion. Even if someone evaluates it, typically treatment for it is ignored, but treatment of the vestibular system is crucial in recovery from concussion. Okay? So first off, let's start off. What is the vestibular system? Okay? The vestibular system is critical for balance. So it's firing at all times, right? I cannot turn my head to the right without my right vestibular system being fired. I cannot have gravity acting on me without my vestibular system being activated. I cannot walk and see what's in front of me without my vestibular system functioning appropriately. You cannot turn your head and read something without your vestibular system functioning appropriately. So this is why those with vestibular issues hate going and being a passenger in a car. They'll tip have motion sickness. They can't do roller coasters. They don't like seeing patterns and stripes. So if they're walking somewhere and the carpet or the flooring's got a lot of pattern, they can't do it. Even if their provider, or else let's say their therapist they're going to, likes wearing nice patterned shirts, sometimes that drives them nuts too, because it's just too much input and they just can't process it appropriately. Now, it's also the thing that can create a lot of postural issues for people because it's very reflexive in nature. And it's one of the ones when you have a concussion, it kind of gets wringed like a rag. And while it's able to be treated, typically without many issues, you really do have to treat it. You can't just say, okay, let's assess it and hope it gets better, because typically it won't get better. And I want to make that point by referencing this research article here. I'll post it on the Facebook page for those who want to see it. It is an open access article, but it's called Vestibular Deficits Following Youth Concussion by Corwin and many others. Now what they did is they wanted to look specifically at pediatric patients with concussion and see how that correlated with cognitive function and how well they did with cognitive testing. The reason why this is important is typically following concussions, I've seen students who are A students or B students all of a sudden become C, D students, sometimes F, because it so impacts their cognitive abilities. Now, this is not a child who's seeking attention. This is a child who really needs help. They need to be treated. Sending them to a psychologist when their brain needs to be fixed isn't going to help the issues. You really need to find someone who knows how to help it. Okay, here were the results of the study. 81% showed vestibular abnormalities on the initial clinical exam. Patients with vestibular signs on the initial exam took longer to return to school. Here's how much. Those who had no vestibular issues returned to school typically in 6 days on average. Now, if you have vestibular issues, it was 59 days. So I want you to think about it. It took them 10 times longer on average to return to school. 59 days is a significant portion of school. And really, think about it. If that's 59 days missed of school, and you're going 5 days a week, right? Think about that. You're missing almost 12 weeks of school, which is almost a semester. But to top it off, if we're looking to fully clear these teenagers and children from concussions, now this is if they truly were fully cleared and back to baseline, 29 days if they had no vestibular issues, and 106 days, okay? That is almost 1/3 of a year. They also did more poorly on the initial neurocognitive testing, and it took longer for those deficits to occur. Now, it should also be noted that those who had more concussions in the past, they had more profound effects, and now I'll explain that in another video why that occurs and what the inflammatory process is going on within the brain. But it should be noted that if you have vestibular issues at all, you need treatment. Don't wait a week or two for symptoms to go away, because when you do look at the research, it actually shows with diffuser tensor imaging studies that even people who report no concussion symptoms at 7 days still actually have issues with how their brain's connecting and functioning, even after a month. So simply an absence of symptoms does not mean someone's recovered from a concussion. That should not really be addressed and stated that someone's fully recovered till their neurocognitive status has been looked at, till their vestibular and their balance system has been looked at, and until their visual system has been looked at in conjunction with their symptoms and a lot of the other factors and issues that occur as a result of a concussion. This was just an initial primer on the vestibular system and how important it is. Once again, the vestibular system is critical in balance and should not only be looked at with concussion, but should be treated as part of any concussion program in order to get the best results. If not, as the research shows, these children, teenagers, and even adults are way more likely to go into a post-concussive state, which is detrimental to their school, their academics, friendships, social, emotional, creates a lot of anxiety and depression, which typically they'll just get meds thrown at them for, which they don't really need the meds. It's because they need an answer, and they need an answer that comes with the appropriate treatment. And then if you're an adult, it impacts your ability to hold jobs. People lose their jobs over concussions, which are mild traumatic brain injuries, because they never get the appropriate treatment.